My name is Henry Daniel Zegzula. Most people call me Dan. I'm a plastic surgeon in Portland, Oregon. Motiva implants, like any silicone gel filled implants, comes from the factory at a specific volume. They have for any particular implant, there's a specific volume, specific diameter, and how much they project or how tall they stand. And Motiva implant is no different in that regard. But Motiva places a priority on sizing patients based on their width, that is the natural footprint of the breast, how wide the breast is, and the projection and volume become more secondary because that's what helps you get a natural look, a natural looking result. Also, all of Motiva's implants are 100% filled. The shell is completely filled with the gel. What that means is when you set that implant on the table, perhaps, you won't see any collapse in the middle. You won't see any rippling on the surface. The shell will be smooth, completely filled with the gel. For that reason, Motiva implants tend to project a bit more. That is, the forward direction of the implants is a little more forward. And for the same width, you get a little bit more volume. For that reason, you can actually go on a slightly smaller volume and have a similar look. And a smaller volume means less weight and a more natural result. So the implants are a little bit different, but they are still only available in very specific sizes. You can't adjust them on the table. You can't fill them with more or take some out. They are filled and sealed at the factory before we receive them. And here's one other really cool thing about Motiva. They have a warranty that allows you as a patient to decide to have your implants removed in the first 2 years of putting them in. If the patient has their implants and feels 1 or 2 years later like implants aren't right for them, if they think that their implants might be making them sick, if they're having discomfort with their implants, they can have their implants removed under warranty from Motiva. That includes reimbursing some of the costs. What it won't cover is size change. You can't say, I want them changed because I want something bigger. That's not covered under warranty. And I think warranties are important. It gives patients peace of mind. Biofilm is a theory for why some patients develop capsular contracture. But I think we also know that there are lots of different reasons why patients may develop capsular contracture. A hematoma or blood around the implant can lead to inflammation and a capsular contracture. A ruptured implant where some of the gel gets out of the implant and over the surface of the shell, the body reacts to the gel, and then you'll get more inflammation and then a capsular contracture. Infection can cause capsular contracture, and biofilm being a type of infection that can lead to a capsular contracture, but it's certainly not the only reason why women or patients develop capsular contracture. The smooth silk surface of the Motiva implants were designed to have low adhesion of bacteria to them, and hopefully that's going to lead to less biofilm and less reactivity. Certainly, the studies are showing that there's a very, very low rate of capsular contracture. Right now, Portland Plastic Surgery Group is the only place in Portland where you'll be able to get Motiva implants, but that's not going to last forever. Motiva is really interested in bringing these implants to the market for everybody, for all plastic surgeons to use, but we're not quite sure when that's going to happen. There's definitely some special training that needs to be done, and they're a bit choosy right now on inviting surgeons to use their product. So for the next few months, Motiva implants will probably be at Portland Plastic Surgery exclusively in the Portland market, but I bet you as we get into 2025, you'll be seeing more and more surgeons adopting Motiva as their implant of choice.